Good evening. Welcome to a panel discussion on substance abuse and mental health in Lake County. This event is sponsored by Advocate Aurora Health and the Lake County Opioid Initiative. I'm Bill Gentes, the Executive Director of the Lake County Opioid Initiative, and I'm going to be attempting to moderate tonight. But before I really begin, I want to thank Sam Martinez, who's to my left. I don't know where she is on your screens. Who is the congregation, I have to read this one, who is the Congregational Outreach Coordinator of the Office for the Mission and Spiritual Care for Advocate Good Shepherd Hospital, Advocate Sherman Hospital, and Condell Medical Center. Without her tireless work on this particular program, it wouldn't be happening right now. And so many, many thanks, Sam. A couple of quick housekeeping notes. As I said, we're taping. We would like if you could mute yourselves so we don't have those odd noises that sometimes have turned into the new normal with Zoom calls. And we're going to be taking questions and having a question and answer session with our panelists later on. So if you have a question, please type it into the chat and we will get to the questions when we're finished with the presentations. And as I mentioned earlier, Advocate Aurora Health is a sponsor of the event. And they've been an amazing partner with us over the years in face-to-face events as well as online meetings. I know personally I've spoken at numerous events. And that type of support, in my mind, always flows from the top, which is why it's such a pleasure to have the president of Advocate Good Shepherd. And her title is President of Advocate Good Shepherd Hospital, Patient Service Area President of Northern Illinois, Karen Lambert, who would like to say a few words of welcome to us. Karen?
Thank you, Bill. Good evening, everyone. Thanks for giving me just a moment to say thank you. First of all, just thanks for taking the time to spending your evening to hear about such an important discussion. We know mental health and substance abuse is a concern in our communities, and certainly during these this last 18 months or so during COVID, we've seen a rise, and it really creates an even greater sense of urgency. And I so appreciate people being interested because we know a concerned community is a community that takes action, and that's how we make impact. We all want. It's okay. We're all used to these Zoom meetings now. We all want a healthy community, and I believe that the best way we do that is when we work together as a team and as a coalition, because it's more sustainable and we get more voices at the table and more ideas. And I just want to thank the Lake County Opioid Initiative, which is a great example of bringing truly experts to the table and people who are concerned to look at how we can improve the health of our community. And clearly these two issues are one that need a lot of continued work. And as I said, particularly recently. I also want to thank the panel for taking the time and being willing to talk through what we're doing and what you're planning on doing, and being able to answer questions from community members. I think that exchange and that dialogue is so important. We all learn from that, and we learn what we can do individually differently, what we can take back to our own organizations, and truly make an impact. So thank you for being here. I know our nights are precious, but nothing is more precious than our families and friends and neighbors. So thank you. My heartfelt welcome to you.
Thank you, Karen. That was very insightful. I know you have to leave to a prior commitment, so you're free to go. But thank you very much for your support and giving us Sam, who's amazing. So I would like to introduce our panelists. We have a very distinguished group today. And first off is Bruce Johnson. He's the CEO of NICASA Behavioral Health Services, which is one of the largest social service agencies in Northern Illinois. Bruce brings an enormous amount of diverse experience, having served in the Marines, law enforcement, and 10 years as a police chief, 10 years plus as a police chief, and now 10 years plus as CEO of NICASA. He is an amazing guy and so committed to what's going on in Lake County, and he's got his fingers in virtually everything, as far as I can tell. Our next panelist is Lake County State's Attorney Eric Rinehart, who before becoming Lake County State's Attorney last year, spent 18 years either as a public defender or in private practice, working on the exact issues that we're going to be talking about tonight. He probably has the least experience of all of the people on this panel because he's so young. So the 18, he's probably been doing that since he was 21. So we can't hold that against him. But the next panelist is Sheriff John Idleburg, who has been our sheriff for 3 years now. And the reason I said that about Eric is what I'm about to say is because I looked at the sheriff's bio online, and I think I would have spent an hour and a half going through all the things he's done. It's so extensive in law enforcement. And before that with the Marines. I did pick out the two most important things that I needed to mention about the sheriff there, with the Marines being the second one. And there's one last panelist who was not mentioned on the marketing material. And as I think of this, I think of one of my favorite cities in the world, which is New Orleans. And every time you go into a restaurant in New Orleans, they give you a little extra that's not on the menu, and they call it lagniappe. And so today's lagniappe is Patrick Furman, who is the Chief of Corrections for the Lake County Sheriff's Department. His bio is just as extensive as the sheriff, so I'm not going to go that deep into it. So those are our panelists. When Sam and I started brainstorming this event, we thought a theme of past, present, and future would work best, which is why we asked Bruce Johnson to address sort of the past and what's going on today, and then the sheriff and the state's attorney to talk about the present and the future, because they're the individuals who are sort of leading us forward with what they view as their mandate and what they can do to improve mental health, substance abuse disorders, and the programs that we do. And I know they have some great ideas, and they've already been working on some great projects as it is. So Bruce, I'd like you to get started if you don't mind.
Well, thank you very much, Bill. Appreciate it. And good evening to everyone. It's really an honor and a privilege to be here tonight. My hope is to help paint a picture of the issues that we have and the collective actions that we as a county have taken relative to opioids, substance use, and mental health in Lake County. So before I really get going, I want to make sure that I have a little bit of a caveat. I, of course, can't mention everything and every program and every initiative, but I want to paint a picture of kind of the collective work that Lake County has done. So I first want to start with where we find ourselves today amid the COVID-19 pandemic. I just want to give you the real reasons why this is so important, and then talk about what we've done up to this point. So I'll just tell you that I did some research, and have recent studies are really suggesting that the pandemic is certainly worsening mental health problems, including an increase in addictive behavior. I don't think anybody would be surprised by that, the isolation that this pandemic has caused. Unfortunately, service providers have not been able to continue to provide their full spectrum of services, and a lot of families are struggling. So of course, this has certainly made an increase in these behaviors. The CDC reported that the nation is experiencing elevated levels of anxiety, depressive disorders, substance use, and suicidal ideations, and that identified populations at increased risk include young people, racial and ethnic minorities, essential workers, and caregivers of adults. We don't often hear about those last two. And locally, for those of us in Lake County, 211 data also shows individuals are reaching out in vastly increasing numbers for mental health and substance use disorder needs. The pandemic is causing long-lasting effects on our residents, and those are going to continue to emerge as time progresses. And unfortunately, if individuals and families cannot meet their basic needs, they're going to be unable to focus on managing their behavioral health treatment, their care, and their recovery. We certainly have families that are struggling with food, medicine, and the basic needs of shelter, and that is an issue for certainly for behavioral health. Alcohol use, substance use, and specifically opioid use are increasing. And according to ODMAP, from March 2020 to May 2020, there was a 42% increase in national overdoses in comparison to 2019. And that increasing trajectory is anticipated to continue. Lake County saw an approximately 25% increase in overdose deaths in 2020, and suicides have increased as well. A CDC survey in just August of 2020 on how the COVID-19 pandemic is affecting Americans' mental health found 75% of respondents 18 to 24 reported at least one adverse mental or behavioral health symptom. 25% of the respondents in this age group seriously considered suicide in the 30 days before completing the survey. That is really significant and an increase in percentages. So having said that, I know I've painted kind of a bleak picture, but what I now want to do is transition to what Lake County has done to address these issues. So I'm going to start by highlighting the work of the Lake County Underage Drinking and Drug Prevention Task Force, the Lake County Opioid Initiative, as well as many other community initiatives that are making a difference for our families, our communities, our county, and even beyond, as many of these programs have been modeled for other areas of the country. So members of the Lake County Underage Drinking and Drug Prevention Task Force have been working to safeguard our children and communities since 2007. So we began this, unfortunately, when there was a specific incident that happened in Lake County, and we really wanted to address the alcohol and substance use of our youth. So over the past 13 plus years, the task force has accomplished a lot, and I'm certainly not going to name all the things that they've done, but they obtained a drug-free communities grant to enhance and coordinate prevention efforts throughout Lake County, and those prevention efforts are just so important. Developing a prescription drug disposal program, which is a partnership of 33 police departments, the Lake County Sheriff's Office, Save a Star Drug Awareness Foundation, and SWALCO, the Solid Waste Agency of Lake County. Placing unwanted, unused prescription drug collection boxes in almost every police department in the county has enabled us to collect and destroy approximately 14 to 16,000 pounds of unwanted, unused prescription drugs every year. That, I hope, is a significant number for all of you as it is for me. Lake County has approximately 5% of the population in Illinois, but we collect probably 20+% of the state's unwanted, unused prescription drugs. And I think I've heard Bill state before that there were some years that we collected more unwanted, unused prescription drugs than 9 states. That's significant. I mean, that is really significant. So since inception, this program has collected about 100,000 pounds and approximately $5 million worth of potentially illegal controlled substances that may have made their way into our communities and to our children and our loved ones. So the Lake County Sheriff's Office, I need to give them a huge shout out because they provide the oversight of both the collection and destruction of the drugs in partnership with SWALCO. Without them, this program wouldn't exist. With the help of our exceptional state legislators, the task force also created a state law to allow for the safe disposal of prescription drugs. Prior to this, couldn't do it in Illinois, which was really a stumbling block, and Lake County, as they always do, found a way to get past that obstacle. The task force also works to add schools to participate in the Illinois Youth Survey, which provides valuable data to help us inform our successful prevention strategies. And they also produce educational media, newspaper inserts in both English and Spanish to help prevent alcohol and substance use, especially for children. And finally, they educate all of us, including our legislators and the community, on the harms of substance use to our youth. Now I want to transition to the Lake County Opioid Initiative, or LCOI, which is easier to say. And they've launched many, many programs to help support citizens impacted by the opioid epidemic. And as I said, unfortunately, statistics have gone up, 25% in fatal overdose deaths last year. This is a significant issue. And the Lake County Opioid Initiative really works hard on strategies to impact those numbers. And as far as we're concerned, one is too many. One of the first things LCOI did was to establish the Law Enforcement Naloxone Program. So all law enforcement first responders in Lake County now carry naloxone. And since the first save in Deerfield on December 25th, 2014, 362 lives have been saved by Lake County law enforcement by the use of this life-saving overdose reversal drug. Prior to that date in 2014, law enforcement did not have the ability to use naloxone. So again, something else that Lake County, and we were the first county in Illinois to do that and really push for all of our law enforcement agencies to carry it. Lake County Opioid Initiative also helped to further the countywide implementation of a text-to-tip program. And I know there's some Lake County board members that are on tonight with us. And without their help and initial assistance, which included some financing, this wouldn't have happened. And Text-to-Tip is an amazing digital crisis intervention service, which was developed by Andy Duran, who, if any of you know him, is just maybe the smartest person you ever want to talk to. He's the executive director of Linking Efforts Against Drugs, or LEAD, in Lake Forest, Lake Bluff, and Knollwood. And Text-to-Tip continues to receive thousands of texts monthly for substance use and mental health crises since September 30th of 2015. And this is something that is now known in all of Lake County schools. Kids know that they can text, and the process, connects them with a licensed clinician, and they get help immediately. Just a wonderful, wonderful initiative. The Lake County Opioid Initiative has collaborated with community leaders and coalitions to bring prevention education information to parents and students conducted across Lake County. And one of the things most people know about the Opioid Initiative is the Way Out program. And this is a law enforcement assisted diversion program that offers 24 hours, 7 days a week, 365 days a year assistance to anyone who wants help for substance use. The program is hosted by 14 Lake County Police Departments and the Lake County Sheriff's Office, and is a partnership with Lake County judges, the Lake County State's Attorney, the Lake County Health Department, and a long list of behavioral health treatment providers. The program was created by then Mundelein Police Chief Eric Gunther, who's now the village administrator. But Eric did a great job and was a huge champion of this. So listen to this statistic. A Way Out has assisted 784 individuals to gain access to treatment, which has positively impacted their lives, bringing peace and hope to their families, and helping to save the lives of many of our participants. And I just can't emphasize enough, somebody that's struggling with substance use that walks into a police department or meets with a sheriff's deputy and gets help and gets into treatment, instead of going to jail, instead of going into the criminal justice system, how amazing is that? And our state's attorney's office, Eric, we can't thank you enough, because as these individuals may struggle with court proceedings and et cetera, we've always been able to continue to get them into treatment. So this is a huge collaboration, and what a difference it's made. In fact, people have come from, listen to this, Alabama, Florida, and California to access the Way Out program and its services. That tells you something about these other states as well. So the resources, and we don't have unending resources, but the fact that we have such well-intentioned people in Lake County that put together this program to help people, it's hugely significant. I want to talk about the Lake County Health Department that, in partnership with LCOI, secured a federal grant to do post-rehabilitation and follow-up and assistance with the participants in A Way Out. And as I said, A Way Out and the Lake County Underage Drinking and Drug Prevention Task Force have been models for other jurisdictions nationally. So I can't name them all, but I'm going to try and hit a few more things, because I know you want to know what else Lake County is doing. So I first want to focus a little bit on the Lake County Health Department and the Community Health Center, which provides crisis care, medication-assisted treatment, training, supportive services to persons experiencing problems related to emotional and mental illness, and drug and alcohol addiction. I want to highlight that they also provide mental health first aid training classes that teach you how to help someone who's developing a mental health problem or experiencing a mental health or substance use crisis. I've gone through this training. It's exceptional. And Lake County has done a great job of training trainers throughout the county and getting this information out into the community, and especially in some of those populations that are hard to reach. So I can't thank them enough and applaud them enough for these services. They're free, and they're scheduled across Lake County, and they're offered in English and Spanish. The Health Department and the Community Health Center also provide life-saving naloxone, and I saw Martin Clancy on this call. He's the exceptional individual that helps all of us with dispersing naloxone into the community. But the Health Department also provides clean needles and fentanyl test strips as part of their harm reduction strategies. These are really significant initiatives that Lake County does. And then we're talking a little bit about harm reduction. Of course, I'd be remiss to not highlight the work of Live for Lolly, and they lead these efforts in harm reduction regionally and nationally. The Lake County Sheriff's Office was awarded a Federal Justice and Mental Health Collaboration Program grant totaling $250,000. But I want to tell you about the significance of this. So the grant's been used to exponentially increase the number of CIT or crisis intervention team trained officers and vastly expand the public sector's training and response to mental health incidents in Lake County. This provides access to medical treatment rather than placing them in the criminal justice system due to illness-related behaviors. It promotes officer safety and the safety of the individual in crisis. So the Sheriff's Department, has to be applauded. This grant has exponentially increased the number of CIT trained officers. And I know from being in a number of meetings that there are people that are calling for police and the Sheriff's Department and specifically asking for CIT trained officers, knowing that they're going to have potentially a different response to their loved one who's in crisis. That's really significant. And prior to this grant, we really saw the number of CIT trained officers dwindling in Lake County. And this has really helped to ensure that, both officers as well as corrections and even telecommunicators, court deputies, all are trained in CIT. So this is a huge initiative for Lake County and something that really helps the communities. Additionally, the Sheriff's Department received grant funding from the MacArthur Foundation, and this has been very impactful for Lake County. So I really would like to make sure I thank the sheriff, personally for the work that he has done and the Sheriff's Department has done. Their collaboration with all entities in Lake County, including the public defender, the state's attorney, and the list goes on to implement some of these initiatives. Has just been wonderful. I also want to talk about the 19th Judicial Circuit, which established the first drug court program in Lake County in 2005. And this really happened after officials became dissatisfied with what we see as a high recidivism rate. The new court integrated treatment into the criminal justice system, and this opened the door for offenders with drug problems to get help. The success of drug court opened the door for the creation of mental health court in 2007. Then Veterans Treatment and Assistance Court in 2011. And the mission of these courts was designed to reduce crime, enhance public safety, and reduce jail populations by providing a comprehensive treatment and supervision plan to offenders who are welcomed into the different programs. These specialty courts follow the ideas set forth in the initial drug court to promote community safety by reducing substance abuse and recidivism of high-risk substance abuse disordered offenders through a coordinated program involving treatment, intensive supervision, and judicial interaction. And the team that works in these therapeutic intensive monitoring courts and these specialty courts is nothing less than amazing. It literally is a team of highly skilled professionals that do everything they can for the individuals that are in these courts. There are also a host of community coalitions, and this is where the work gets done, in the community. So I can't list them all, but there's the Stand Strong Coalition, ELA Coalition, North Chicago and Shields Township Drug-Free Community Coalition, Zion Benton Coalition for Healthy Communities, United Partners Substance Abuse Committee, Mundelein Stand-Up Task Force, Linked Together Coalition, Speak Up Prevention Coalition, Community the Anti-Drug, Barrington Be Strong Together. And of course, I talked about the Lake County Underage Drinking and Drug Prevention Task Force, and there's more. And I think my point in saying that is there's probably a coalition in your community that you could get involved in that would help both substance use and mental health. And if there isn't one, my challenge to you is start one. And, I'll volunteer Bill Gentis to help you if you're interested in starting a coalition in your community if there isn't already one there. I want to talk about also the COAST program, which is the Crisis Outreach and Support Team. And this is a collaborative partnership between the Lake County Sheriff's Office and the Lake County Health Department. And the COAST team consists of a deputy sheriff and a licensed mental health counselor who follow up after deputies encounter a mental health interaction or an opioid overdose. So the deputy checks the well-being of the person and will determine if they sought any treatment or services since the initial event, and then provide a warm handoff to the health department counselor who conducts a brief assessment and, if necessary, refers the person to appropriate services. And just recently, they added peer support services to the COAST team. So I guess I'm getting to the end here, and you're getting tired of hearing my monotone voice. But I wanted to highlight that Lake County has been working on bringing a crisis and wellness center to Lake County for a long time. So some of you have been in meetings with me and many others, and the Lake County Board and Chair Hart, and just about every representative of every organization and agency that you can think of has been really pushing to get a crisis and wellness center in Lake County. And we are getting very close to bringing this to fruition. So that's exciting, and it's not going to be the end all, but it is going to be a great complement to our exceptional hospitals, NAMI Lake County, and all the agencies that provide behavioral health and social services in Lake County. So here's my last take. None of these initiatives would be possible without the work of the countless stakeholders in our county that include our local elected officials, Lake County board members, our state's attorney, public defender, sheriff, coroner, clerk, judges, adult and juvenile probation services, state and federal representatives and senators, and all the willing volunteers, organizations, and partners that bring these thoughts and ideas to fruition. Without all of them, can you imagine what the statistics would look like without all of these programs, initiatives, and the work that's being done in Lake County? Couple positive things, this is, I guess, good from a national and state perspective. The American Rescue Plan Act was signed into law by President Biden, and this provides $4 billion for expanding mental and behavioral health services. That's a huge problem. That's a huge plus. And in the state of Illinois, I want you to know that funding for mental health and substance use disorder prevention and treatment has been increased under Governor Pritzker's proposed fiscal year 22 budget. So those are two positives. And I think what it tells you is that I think everybody is recognizing that we need to spend a lot more, much more for substance use and mental health services and treatment, not just in Lake County, not just in the state, but in our entire country. Thank you so much.
Thank you, Bruce. We appreciate that. Without further ado, I'd like to introduce Eric Rinehart. Eric, take it away.
Thank you so much, Bill. Thank you, Bruce. Can everybody hear me okay? Give me a thumbs up, maybe, everybody, okay? I can see Mr. Clancy on my, thank you. Boy, thank you, everyone. Thank you, Bill and Karen, for inviting me, and really appreciate this opportunity. I certainly, I think this is such important work. I really appreciate what Bill said about the clients that I had been working with prior to becoming the state's attorney, and these programs are amazing. And the first thing I want to say, even though we did have a change in the state's attorney's office, I want to keep all of our partnerships with all of these programs and all of these amazing things that Bill and LCOI and Bruce and Mr. Rinehart, who came before me, built. And I want to give credit to all of those people. And I just came here. I just got to the state's attorney's office. But as Bruce sort of talked about where we have been and sort of where we are, I'd like to talk a little bit about some of the things that I want to contribute as the state's attorney, and some things that I think we can improve sort of on the courthouse side. I think Bruce did an amazing job of sort of talking about the different institutional help we have from the health department, from the sheriff, from the non-for-profits like LCOI and Live for Lowry and NAMI and all of these fantastic coalition sort of umbrella organizations. I see my job as the state's attorney to take this mission, this moral mission, to treat people into the courthouse. I see my job as the state's attorney to not only take that moral imperative to help people, to help our fellow humans, but also the obvious utilitarian benefit it has, that it not only does it help these people and their journey as individuals, but also it reduces crime. It makes us all safer. One of the things I have to do as the state's attorney is think about the externalities of this. I had a very important meeting yesterday with AIM, the Alliance Against Intoxicated Motorists. That was a really powerful meeting for me as I thought about some of the externalities that drug cases can have on people. I recently spoke to a father who lost his son to an overdose. One of my supervisors was speaking to me today about a close family member he lost to an overdose. These are the things that I want to try to reduce through the courthouse work. Everybody else is doing amazing community work, and I want to take the responsibility of saying that this work must also be done in our courthouse. And Bruce talked about this. Our judges have done an amazing job of starting this work. And the thing that I want to do is continue that work as the state's attorney. I want to expand the drug court and the mental health court programs. I want to state that clearly to you, that is one of my goals and something that I want everybody on this call to hold me accountable for. To give you a couple numbers today, we have 20 individuals in drug court. We have 25 individuals in our STOP probation, which is a program that is directed at opioid users. It's a very special probation program, and our partners at Lake County Probation are doing an amazing thing. I believe we have about 30 individuals in mental health court. The work that those caseworkers and assistant state's attorneys and assistant public defenders and probation officers and judges are doing is unbelievable. And it is not only helping those individuals, it is really making our community safer. But I want to expand those programs. I don't think 20 people in drug court is enough. Drug court and mental health court, veterans court, these are, in my opinion, the sort of jewels of our recovery network insofar as the courthouse is concerned. I think we need to expand these programs. And that's going to be a budget request I make. And if you know any county board members, I think I see a couple on here, talk to them. Say, hey, I heard Mr. Rinehart talk about wanting to expand drug court. How do we do that? I think we have to talk to our stakeholders in the judiciary. We have to talk to our partners in court administration and in the health department about how do we get more caseworkers? How do I get enough state's attorneys to do that? How do we get enough public defenders to do that? But let's talk about that explicitly. Let's talk about that intentionally. And I'm not going to be satisfied in terms of what my work is until drug court, mental health court, and veterans court are expanded to meet what Bill and Bruce have both talked about as a growing need after the pandemic, or as we come out of the pandemic. So that's something that's sort of something concrete that I want to propose to this group as something that the state's attorney's office can and should do. I think many of you have probably heard me speak before, but or if you have heard me speak before, many of you would remember that I believe in data, and that's why I've talked about some of these numbers today, because I want to make sure that we're very intentional in how we speak about these numbers. That's why I've used the MacArthur grant to get the first data analyst in the state's attorney's office to look at some of these numbers and to look at how some of these things are playing out over time. I strongly support a way out program. It's something that we hear about from the Lake County Chiefs Association every time I meet with them. One of the things that I'm proudest to be part of, and certainly LCOI and Bruce and Sandy Hart deserve so much credit, and the sheriff's office as well, for the Wellness Center. But that Wellness Crisis Center is something that the state's attorney's office is the lead agency on. It was built that way before I came into office, and I'm thrilled and humbled to continue that work to build the Wellness Center. And what the Wellness Center is, it's going to be a place where police officers can drop off individuals who are going through a mental health crisis. Bruce did an amazing description of the Way Out program, where officers are helping individuals in need of substance abuse treatment who've come voluntarily forward to say that they need that. Well, with our Wellness Center, we want to do the same thing in terms of police officers and the sheriff's department having a place where they can bring mentally ill individuals or who are going through crisis, rather than an emergency room, rather than a jail. We will have this Wellness Center. And as Bruce said, we're getting very close. And we're looking forward to the sort of public education efforts that we get to engage in here in the next couple months to really get people interested and in the know about that program. And that's my ask of this group. I'm going to need everybody's help on this call. I might even ask Bill for the email list. I'm going to ask for everybody's help on this call to get the word out about the Wellness Center and to speak to your county board members and your other local elected leaders about the need for expanded treatment. It was fantastic to hear from Bruce. I had not heard that yet, that the governor had identified treatment as a budgetary goal, or something that, of course, would be expanded. I think that's amazing. So I'm happy to answer questions later in our program about some of the things I believe in. The sheriff has been an amazing partner on these things. I'll certainly let him speak about this because it is his program and he gets all the credit for it. But I was very proud to lend my support as the state's attorney's office to medical assisted treatment inside the jail when it comes to opioid withdrawal. I'm sure he's going to talk about that. But I just want to say that I fully support his work in that area, as well as in all these other areas. And I love working with Bill and Bruce and the sheriff to make sure that we are getting as much treatment and as much services as we can to the people who are in need. Thank you very much.
Thank you, Eric. Very appreciated. Sheriff, you're next.
Good evening, everyone. It's a pleasure to be here. I want to thank the Lake County Opiate Initiative for hosting this forum. I'm honored to be on this panel with a respected group of individuals. We continue to see substance use increase year after year. And in fact, just last week, the Daily Herald article highlighted the facts Illinois has seen opiate death increase 32% in 2020 from 2019. Think about that number for a second. Nearly 3,000 individuals living in Illinois lost their life last year to opiate-related overdose. That is a hard fact we just cannot ignore. While we have to do everything we can to hold drug traffickers accountable and prevent them from distributing drugs in our community, we can't forget those caught up in the cycle of substance use disorder. I think everyone on this panel can agree that those dealing with substance use disorder need all the assistance they can have to help them through this recovery process. We want them to recover and to be contributing members of society. We see more and more evidence to suggest there are many people living with mental health issues who are self-medicated, which oftentimes leads to substance use disorder. These are two big things that often coincide. If we want to really look at the root cause, we can't focus all our effort on simply arresting drug users. We have to think big in a broad term. We must look at a bigger picture. When I took office, I looked at very details of looking at our approach to drug enforcement and what we were doing to help those living with substance use disorder. After evaluating, I redirected the effort of the Special Investigator Group to focus on high-level drug traffickers versus focus on end users. It makes much more sense for our group to enforce drug laws to put their time and effort investigating those who are illegally making millions of dollars by distributing and selling drugs in our community, providing aid and assistance to end users, especially when those are substance use disorders involved. Last year, Lake County was selected to be included in the high-intensity drug trafficking area HIDA program. And based on those programs shown by the Special Investigator Group and our partnership with the Lake County State's Attorney, being in the HIDA program, Lake County Sheriff received money directed from the federal government to combat drug trafficking, production, and drug trafficking. Last year, our Special Investigator Group seized $3 million worth of illegal drugs and 55 illegal possession firearms. This, without a doubt, saved the life of countless Lake County residents, but there's still more work to do. We have to look at substance use and mental health with a multi-pronged approach. As I stated, enforcement is very important, but just as important as mental health component. Some of the initiatives I have been proud to sponsor are working with the Lake County Board Chair, the MacArthur Foundation Safety and Justice Challenge, and other Lake County stakeholders to develop a plan for a Lake County Wellness Center. This future facility will allow law enforcement to divert people from the jail by dropping them off at a wellness center for behavior health assessment and local service programs. This will serve as a hub to community organizations with an on-site comprehensive team consisting of peer recovery specialists, intensive case manager, and a registered nurse. I have requested that all our personnel to become certified in crisis intervention team CIT training. CIT training gives our staff a much deeper understanding of mental illness. That sign that someone is in a mental health crisis, how to properly interact with those individuals, taking time, having a calm demeanor, and a positive engagement with those experiencing mental health crisis is imperative. This greatly reduces the likelihood of any sort of force being used. I am very proud to say 99% of our sheriff deputies have been CIT certified. The Lake County Sheriff Office is a proud member of the Way Out program. Therefore, someone who is looking for assistance getting into treatment can call us, flag a deputy down, or walk right into one of our facilities 24 hours a day, 7 days a week. Our deputies are available to assist anyone who is looking to get into treatment. Another initiative we have ensured is that our frontline staff are supplied with Narcan. Our staff have saved over 100 lives since we equipped our staff with Narcan. We rarely go more than 2 or 3 weeks without using Narcan on a person having an overdose. Lake County worked very hard to keep prescription and over-the-counter medication out of the wrong hands by having a drug drop box in our lobby. Everyone is welcome to come into the lobby to drop off unused or unwanted medication, which ensures it does not get into the wrong hands or pollute our environment or ending up in our landfill. We also host drug take-back events where the public can meet us at various locations throughout the county to drop off medication. To wrap things up, I want to express how important it is that we all of our government and private stakeholders work together to address this major issue. I can't stress enough how important it is that we think outside the box in an effort to keep improving the service we provide to our community we serve. We are heading in the right direction, and I do believe we are making some significant strides. Thank you. Now I'll turn it over to Chief Furman. He could talk about a medical assist treatment program in the jail.
Thanks, Sheriff. Excuse me, I wanted to just start by saying, it's important that we don't take it for granted that the sheriff supports this program. I think that's not the norm in sheriff's departments across the country. And I think the fact that Sheriff Idleburg has stepped up and said that this is an important program and he supports it, that's a big deal. And that's something that we as a community should not take for granted because it's not the norm across the country. And so I'm excited to have the support of the sheriff as we move things forward within the jail to provide medication-assisted treatment programs. I wanted to share just a couple of things real quick on what we're doing in the jail and where we hope to go. Currently we've got methadone and Suboxone that we utilize for pregnant females when they come in to protect the infant. We want to expand our program, and so we just had our medical staff trained recently on the use of Vivitrol to utilize for both opioid and alcohol substance use disorders. So we hope that we've got that program kicked off. We're including some programmatic counseling with that as well. We know that just the medication itself is not appropriate. We also are working in conjunction with the health department to provide the aftercare. We want to make sure that individuals that we start on this program have a place to go to continue that treatment when they get out. Bruce and the sheriff both mentioned Narcan for the road deputies and for road police officers. We're utilizing Narcan in the jail. We've got a number of our staff that are trained as trainers. And so part of the program that we're trying to kick back into gear is training inmates on the use of Narcan. It's about a 30-minute training program so that when we train the inmates in Narcan, when they're released, we can give them a Narcan packet to use and take with them. We know that typically they would go back and be around others that perhaps would be users. And in that environment, we want them to be able to perhaps save a life and reverse an overdose. And so we're excited about getting that program moving. We also understand that medication-assisted treatment program is not just those 2 medications, but it's much more than that. And so we've recently applied for some assistance with the Illinois Learning Collaborative to support medication-assisted recovery implementation for justice-involved populations. And that's a collaborative, it's a learning collaborative where we work in conjunction with, we've had support from the state's attorney's office, from the health department, from the county, from probation, to look at where we're at with our medication-assisted treatment programs and where we want to go, and then help us put together a plan to get there. So we're excited about getting approved for that collaboration and getting that kicked off later this month as well. But again, a lot of things going on in the jail. We're excited about kicking off these programs and making a difference in people's lives.
Well, thank you, Sheriff. And thank you, Pat. Very much appreciated. We do have a few minutes for questions. So if you have some questions, feel free to type them into the chat and we'll sort of take them one by one. But I do have someone who sent in actually a question or a comment to Advocate today that I actually had on my list of things here, but he's actually on the call with us. And Ryan, I know you're muted right now, but if you have a couple comments you want to make, feel free.
Yeah, hey guys, my name is Ryan Heller, and I just came on to log on today because I actually just wanted to praise Lake County for everything they're doing in recovery. I actually just graduated from the drug court program. I've been off probation for about a month and a half now. My graduation was last Wednesday. And I just want to, you know, I have a little over 2 years clean, and, you know, I just want to completely praise the whole drug court team. And, you know, Lake County is awesome when it comes to recovery. They helped me rebuild my life, and, you know, I got my CDL, and, you know, Bridge House also, it's good to see Bruce Johnson. You know, Bridge House, not all counties have the, you know, the access and the things that we have as far as when it comes to recovery as Lake County has. Like, Bridge House is such an awesome program, and, you know, Bridge House taught me so many things, and, you know, it saved my life, and just it's just an awesome program that they have there with NICASA, and, you know, the work that Judge Bishop puts in, and Mike Ori and Joy Gossman and the whole state's attorney and all the probation officers and Sharon Petticourt with Lake County. They just completely saved my life, and I'm just here to start giving back to the community and being able to get involved in helping other people save their lives. And you know, the hard part of it is that people have to be ready and go through enough pain. I had to go through enough pain, and I just thank God that I got to that point. And the Lake County Drug Court is just such an awesome program, and I'm here to just do whatever I got to do to keep that program running and funded, and just to start giving back to my community and start saving lives. Because the pandemic, I brought numerous people in the Way Out program. It's such an awesome program. I brought, you know, over 5 people. You know, that's so awesome. You can just go into a police station and ask for help. You know, you can't do that anywhere else. Like you said, you have people coming out of state. Like, that is such an awesome program. Like, you can just go in and ask for help. And you know, I'm just trying to do my part and continue to give back. And because, you know, it's, you know, getting clean and sober it's possible, and how mental health and addiction correlate with itself. It's just so meaningful to me to start being able to give back. And that's all I want to do is thank Lake County for all the programs they have. Lake County is just so awesome when it comes to recovery, and I'm just here to support this in any type of way. Thank you.
Thank you, Ryan. It comes from the heart. Thank you. We have a one question here. Oh, it's actually not a question, just a comment from Linda Peterson.
Thank you, Bill. You know, I sit here and I listen to, I know in the back of my mind everything that everyone is doing for the residents in the county. But when I listen to Bruce Johnson list all those things, it's absolutely amazing. And I know that I can speak on behalf of the whole county board that we are very, very appreciative of all that you're doing to help our residents out in Lake County. And I just want to say thank you.
I do have two questions here. The first one is directed to the sheriff. And the basic question, I'll sort of synthesize it here. As we work on, all these programs to keep people out of the jails, is there actually what kind of taxpayer savings can we expect for not having jail cells full? Is there a way of actually discovering what that number is and sort of getting a tangible relation? This was a long question. I think I synthesized it well, but we don't know.
All right. It costs the county $100 a day for each inmate that's in our jail. That's not including the medical costs related to individuals. We have individuals here that need dialysis. There are people here on special medication. And right now, I want to say the population of the jail is 446 individuals in the jail. So you multiply that $100 a day for a whole year, that's a large amount of money. And then we also have a majority of those individuals in the jail are on pre-trial. So they're waiting for their trial date. So again, we're talking about hundreds of thousands of dollars that could be saved for the taxpayer of Lake County with these programs or implementing these things for our citizens of the county.
Thank you, Sheriff. I have a question here also that was sent to me for you, Eric. You mentioned that you're collecting data. Do you collect data on mental health issues in relation to prosecution, or what do you do on this?
Sure, I can explain that a little bit more. The collecting of the data is simply to collect trends, to show trends. So for example, I can tell you that 13% of our felony caseload, I just looked at these numbers, 13% of our felony caseload right now involves the top charge. So there could be a lot of lesser charges, but 13% of our felony caseload right now involves drugs directly. People may be stealing. I'm not counting people stealing for drug purposes. I'm not talking about those sorts of things. And if you have an armed robbery and a small possession case, I'm only counting the armed robbery. But the top charges for 13% of our felony caseload today, this is a snapshot, this is a very informal number, is 13%. So we're using this on very top line. We're not going to be publishing any private information about anybody. This is to have very sort of top line numbers for everybody. It's something that's very important to me to look at any sort of racial component to these numbers, to look at how are we giving out our diversion programs. That's very important to me. I don't think that type of work has been done in the past. We just finished some of our data analysis of about 5 years of diversion numbers. And so we're really trying to show trends and racial breakdowns. Did the DUI filings go up during the pandemic? Well, we all sort of think that. We all sort of anecdotally think that, but I want to be able to announce that, to have it up on a data dashboard, because I think any type of data-based approach is going to be the strongest approach.
Thank you, Eric. I see a couple comments here, but nothing, no sort of questions. Are there any questions that anyone else has? Feels free to answer, or ask, I should say, not to answer. I guess going once, going twice, going 3 times. I told you it would be an hour. It was 55 minutes. I'm very proud of myself. Thank you all for attending. Thank our panelists, Eric, John, Bruce, Patrick, thank you very much. And if she's still here, Karen Lambert as well for hosting, and Sam, thank you very much.